legislature enacted Senate Bill 2502, the implementing bill, which included a directive for AHCA to establish a monthly billing methodology for life skills development levels 3 and 4. This applies when a recipient receives 16 or more days of these services within a calendar month. These services are provided to clients of APD under the iBudget program and are reimbursed to providers contracted with APD. Here to present the monthly billing update is Ann Dalton, the Assistant Deputy Secretary, Division of Medicaid with the Agency for Healthcare Administration, as well as Susan Nipper, the Assistant Director of Operations and Programs from the Agency for Persons with Disabilities. Y'all are welcome to come up and give your presentation. And members, if you have a question during the presentation, please flag me down. But ideally, we'll let them present and then save questions for the end, because I hate being interrupted in mid-presentation when I'm in a flow, and I figure you guys do too, so I don't want to ruin your train of thought. But y'all are welcome. Thank you for being here this morning.
Okay. Thank you. Good morning, Chair Andrade, Vice Chair Gonzalez-Pittman, and members of the committee. My name is Susan Nipper, and I have the privilege of serving as the Assistant Director of Operations and Programs for the Agency for Persons with Disabilities. Thank you so much for inviting us here today to share information regarding the monthly rate development for Life Skills 3, Adult Day Training, and Life Skills Development 4, Pre-Vocational Services. The Agency for Persons with Disabilities, or APD for short, supports individuals with disabilities and their families in living, learning, and working within their communities by creating multiple pathways to possibilities. Currently, there are over 36,000 individuals enrolled on the iBudget Florida Waiver, which is APD's most well-known pathway for individuals with developmental disabilities. APD provides critical services and supports for individuals so that they can reach their full potential. The iBudget Waiver has a suite of 27 services that are available to all waiver clients depending upon individualized needs and goals. Life skills development services include companion, supported employment, adult day training, or ADT, and pre-vocational services. These services teach skills for independence in activities of daily living, community integration, and work-related abilities. ADT provides meaningful day activities intended to support the participation of individuals in valued routines of the community that are age and culturally appropriate. These activities and environments are designed to foster the acquisition of skills, building positive social behavior and interpersonal competence, greater independence, and personal choice. Pre-vocational services provide learning and work experiences where individuals can learn and develop general skills that lead to competitive employment. The successful outcome is integrated employment in the community, where they are paid no less than minimum wage and no less than individuals without disabilities for the same or similar work. A wide array of APD clients attend ADTs from all different types of living settings, whether it be from a group home, family home, independent, or supported living. We have approximately 13,600 clients that receive ADT services and approximately 200 clients that receive pre-vocational services. Statewide, there are 385 providers of ADT. Based upon claims data, the largest percentage of clients attend ADT between 16 and 20 days per month for an average of 6 hours a day. This information was instrumental in the process of rate development and how APD and AHCA defined a day. The standard 1 to 10 rate is paid when a client requires minimal assistance. Lower staffed client ratios are used for those individuals that have behavioral or medical care needs that cannot be met at the 1 to 10 rate. I'll now hand it over to Ann Dalton to talk through the legislative changes and where we are today.
Thank you.
Thank you, and good morning, Chair Andrade and members of the committee. I'm Ann Dalton. I'm the Assistant Deputy Secretary for Medicaid Policy and Quality with the Agency for Healthcare Administration. And before I go into the next few slides, I just want to thank you for giving me the opportunity to present today with my colleague Susan Nipper from the Agency for Persons with Disabilities. So as directed by the 2024 General Appropriations Act, AHCA, in consultation with APD and stakeholders, produced a report in December of 2024 focusing on alternative payment models for adult day training services based on a study conducted by AHCA's actuarial services vendor, Milliman. As part of the 2024 report development, provider feedback was collected through a survey distributed to adult day training providers who had emails on file with the Agency for Persons with Disabilities. AHCA received a response rate of about 31% to that survey, and the results of that response was incorporated into the final report. The monthly rates calculated by Milliman were modeled to be budget neutral and within legislative appropriations, and to maintain parity with current reimbursement relative among the regions and groups. The report provided APD and AHCA with the rate options for monthly rates calculated for 16 or more service days with at least 4, 5, and 6 hours per day of service utilization. However, I did want to take a moment to update you that since we finalized these slides, we have both been in contact with our provider community and are taking another look at our approach to the rate development than what was published in the report that Milliman released in September of 2025. We want to make sure that we are considering the needs of our providers. We value our provider community and know that we need their partnership in order to make the Medicaid program successful and to get those services to the recipients who need them. So we are in current conversations with our provider community on the rate development. So AHCA and APD are currently in the process of completing systems work to implement the monthly rates. We do anticipate that this systems work will be able to be completed and begin paying providers at a monthly rate by the end of this month for services provided during the month of October. We are also initiating rulemaking to promulgate the new rates into Rule 59G-13.081, Florida Administrative Code, and anticipate completing that rulemaking around February 2026. Our ultimate goal is to work with our providers while avoiding payment disruption and ensuring that all services rendered on or after October 1 can be reimbursed at an appropriate monthly rate. This slide shows a chart of the action steps, target dates, and the status for completion of each of those action steps. And as shown in the chart, we are committed to be on track with implementing the new monthly rates in accordance with the legislative direction. That actually concludes our presentation that we have prepared for you this morning. Again, thank you for giving me the opportunity, and I will invite Ms. Nipper back up and we can take any questions that you may have.
Thank you both very much. Members, any questions? Representative Tant, you're recognized.
Thank you, Mr. Chair. Thank you for your presentation. I have a couple of questions, but this one centers around the rates. So how does the monthly rate compare to the hourly rate? And then second part of that is, when you say you're taking another look to see what providers need, what's the genesis of that and what are we trying to address?
Y'all are recognized.
I can start and then see if APD has anything to add. So the current rates are provided hourly at the different staffing ratios, and there's geographical, non-geographical, and Monroe County stratifications with how those rates are developed at the hourly hourly. And the report that Milliman produced for the agency and APD had proposed some different models where using the current fee schedule as well as the current staffing ratios and the geographical stratifications to develop different options based on either a 4, 5, or 6 hour a day utilization. So when I made the comment that we were relooking, it has come to our very recent attention that there may be concerns from the provider community with the information and the proposed draft rates that were included in what was presented in last month. And so we are wanting to understand more about how we can make sure that we are meeting our providers where they are and making sure that their needs are accounted for.
Follow up?
Thank you, Mr. Chair. So in respect to that, my question was, are they getting paid less for a monthly rate versus the hourly rate? Are we making sure that we have not dropped what they're getting reimbursed for providing the same services?
So that is, thank you for the question. That is exactly what we are taking a second look at. So we are aware that for an individual who attends 16 days during the month, that's where the monthly rate kicks in. So if an individual is attending 16, 17, 18, 19 days per month, the rate does make them whole plus. It's when you get to the 20-day or beyond mark that there is a slight dip in the revenue. But when you look at it, it's not just one person, it's the sum of all that are attending. So the net utilization is not 100% for every client every month. So the rate that was developed by Milliman does put it slightly under, but again, we are looking at it because I understand that is not the intent of the legislature. So we want to make sure that we get it right.
Follow up?
Last question. Thank you, Mr. Chair. In respect to the adult day training programs, are you looking at where they are in the maps to make sure that we've got enough of them that are standing up providing these services? Because I know in Leon County and this area, there's only one. And they're capped. They can't take any more people, and the population isn't slowing down. So do we have enough providers out there providing the services, and what are we doing to make sure we have adequate providers to meet the needs of this population?
Thank you for the question. I do not have the numbers in front of me of where those different distributions are geographically, but I can say that we are actively working on provider development for all services, and that initiative is underway.
And Representative Woodson, you're recognized.
Thank you, Mr. Chair. Good morning, and thank you to both of you for the presentation. I have a few questions, Mr. Chair. I would a few questions here. I know you went over the hours, but what specific costs have you analyzed to determine the cost of reimbursement? And how do they compare to the previous rates that you have? The specific costs that you look at before you determine the rate reimbursement?
Thank you. Milliman used the current rate table for the current hourly rate as the basis and looked at claims data from prior year expenditures to develop the rate, if that was the question.
Follow up?
Yes, thank you, Mr. Chair. Were there any particular areas where the costs have significantly changed? And what are the implications on service delivery?
You're recognized.
I want to answer your question appropriately. So the rates are standardized, so the rate wouldn't have changed from the current hourly that providers are paid for the services.
Did you say they would not change?
They would not have changed in the previous expenditure history because the rates are set. So those, perhaps I'm not understanding, I'm sorry.
Now, if you're looking at changing rates, right? Mm-hmm. You have to look at first this item, let's just say whatever service that is being provided, it costs more than another item, another service that is being provided to that same person. So I'm trying to see what were those items that you looked into in order to determine the reimbursement in order to be fair to the providers. That's
If you have a clarifying, yeah.
So I'll try to clarify a little bit, but just going back, we are still, the rates are draft that we're looking at establishing the monthly rates that we were directed in 2025 to establish through the General Appropriations Act. And that's what we're still working on finalizing. But the approach that the Milliman report took was looking at taking that hourly rate and looking at the current fee schedule that's already set for that hourly rate based on historical utilization for that hourly rate, and basically using both of those components to come up with a methodology to set the hourly rate based at the different staffing ratios and geographical regions. And so it was an average, essentially. And so when I mentioned that their approach was budget neutral and within the appropriations, I meant by budget neutral was because it was only using historical utilization without projecting an increase in utilization. It's just something that I think we would have to monitor moving forward, but that's what the actual proposed draft rates that they had included in their report were based on, just historical utilization and the current hourly fee schedule.
two more questions, Mr. Chair.
You're recognized for a
Okay.
follow-up.
Thank you, Mr. Chair. Thank you. My next question to you has to do with respite care, and I have another question after this one. Let's just say, taking the case of a mother who is taking care of her child with disability, and she has other children, so she takes care of that child the entire week with the other children. Are there any respite care factored into the rate that you are looking at now? Or did you give any consideration to respite care when you're looking at the whole picture?
I don't know if that's a fair question for what y'all were prepared to testify to today, but if you can answer the question, you're welcome to.
I can just answer it straight related to these rates that we use very specific procedure codes that exist, and it's for the existing pre-vocational services and adult day training, so not respite, and that's what was used as the basis of the historical utilization that was incorporated into the methodology that Milliman had provided.
Follow-up?
Since that question, like you say, doesn't apply to, I have another question, Mr. Chair.
You're recognized.
Thank you, Mr. Chair. Given the anticipated timeline for the rate reimbursement, for the new rates, what steps are being taken to ensure a smooth rollout of the rates?
Thank you for the question. So we are working on provider advisories to ensure that all providers are aware, working with waiver support coordinators to ensure that as soon as the rates are available, that service plans for the individual clients can be updated so that new authorizations for a monthly rate can be disseminated to the providers.
Any more follow-up?
How do you anticipate, thank you, Mr. Chair. How do you anticipate the new rates will affect the financial stability of the providers? How do you anticipate the rates?
Thank you. That is something that we are still looking at, and part of the legislation was for fiscal impact reports to be conducted and completed. So we'll be looking at as claims begin to come in and as we realize how many people are converting from the current hourly to the monthly rate.
I'll come back. There might be some other people. I'll come back, Mr. Chair.
Representative Cassell, do you have any other questions? Any other member questions? Representative Burfield, you're up.
Thank you, Mr. Chairman. You talked about the fact that you are looking at ways to develop the workforce and everything else. Could you tell us a little bit about what you're trying to do there? Because that's certainly going to be a pressure point as far as the finances are concerned.
Recognize.
Good morning. Thank you so much. So we are working on, our provider development group is working on building the pool of providers that can deliver services to our clients. So going out, I know that there are regional events planned where we are going to solicit provider networks and provider communities to come in and talk to them about the needs and just do engagement and see how we can help each other and what they may be able to do to support more of our clients.
Well,
So the issue is the provider entity, not necessarily the workers that support the provider entity.
you're recognized.
Thank you. So these are private businesses. So, the first step is to make sure that we're in communication with the businesses that hire the workers, that do the work and deliver such important services. So they'll have to staff up in order to support the clients.
Anything else, Representative? You're recognized.
So just to be clear, it's a matter of outreach. We don't think it's a matter of shortage that we don't have them.
If you can answer the question.
I don't have the actual numbers in front of me, but we'd be happy to get back with you and provide additional information.
Any other first-timers? Representative Mello.
Thank you, Chair. First timer. Ooh,
I
never been called that
apologize.
before.
We have a very active
We
group
do.
of those asking questions so far. So.
Yes, we do. Thank you and good morning. My question is, you had mentioned a 31% response rate on this study done by Milliman. Is that correct?
Yes.
So can you help me to understand, that seems like a very low number, and we're basing this outcome on a 31% response rate. Is there anything we could do to increase that number?
So just to clarify, that survey was sent out in response to the 2024 legislation with the first report that the agency produced that was submitted in December of 2024. And that was kind of like the start of our engagement with the provider community. And it was sent to all the ADT providers that we had, or that APD had an email on file for, which was 187. And of that 187, it was only 58 providers that turned back in a survey, which is where I got the 31%. But in response to the second report, that was in response to the 2025 legislation from September of this year. That is the provider engagement that I referenced, that we're really starting to dig in with the providers to understand the impacts of what was proposed in the Milliman report, and to make sure that we can get to a place that makes sense to everybody involved.
Follow-up.
Yes, thank you, Chair. So do you feel that there are concerns that there is not adequate information at a 31% response rate for this to be viable and accurate?
You're recognized.
I think in terms of the original survey, the 31% did give us a good starting point and a basis to start to collect the information on what was important to providers, which was what most of the questions were on how we should be looking at the rates, such as the ratios, the staffing ratios to enrollee ratios, as well as the geographical regions, acuity. So things like that is what we were looking to get from the providers through that first survey. And now that they, the provider community, we put out a draft rate, something to respond to. I think, just in the very recent future, we've been able to have those more detailed conversations about the impact of the actual numbers that have been, put on a page just recently.
After proposed rates come out, I can see the incentive going up for communication with the agencies. Do you have follow-up?
I have one last.
Sure.
Thank you, Chair. And is it possible with a vendor like Milliman that we could, because we've seen in the APD world in the wait list that just sending out an email isn't really sufficient. Is it possible that we could encourage this vendor, instead of just sending out an email, possibly doing even a follow-up phone call, something a little more personable? Thank you, Chair. That was it.
You're recognized.
Thank you for the recommendations. I definitely think that's something we can take back. We do, Milliman is the agency's actuarial services vendor, and we do surveys occasionally with our providers, so we'll definitely take that back. Thank you.
I did have one question along that line. You mentioned provider feedback after seeing the proposed rates. Do you have a general understanding or idea of the number of providers the agencies have heard from since those proposed rates have come out? Just a rough estimate.
I am not going to be able to quantify numbers, but, we have been in communications and currently still talking with members from AHCA, members from FARF. So, with the larger associations, which represent
The whole population. That's helpful. As far as a shift from an hourly reimbursement model to a kind of a monthly type of base rate, what's, if you can what's your perspective, y'all's perspective, your own subjective perspective on the reaction from providers? Do you see a significant number of providers viewing this kind of shift in reporting and reimbursement as a benefit, or are providers saying they'd rather stick to this hourly reimbursement on the whole?
I would say that from those that we've heard from, they're in support of the monthly rate. So, we want to work together to serve the clients as best we can. And taking a lift off of providers and making it easier, streamlining things, is always an added benefit of that.
Thank you. Representative, do you have a question?
Yes, sir, Mr. Chair. In respect to the hourly rate, and you've got Johnny, who is medically and developmentally complex, and the provider's intending for him to be counted in that monthly rate, but he misses a day or he has a doctor's appointment and is out for several hours. Does that account against him in that monthly rate, or does he now have to go to hourly under this proposal?
Recognize.
Thank you for the question. So for that situation, the client would need to be there, Johnny would need to be there at least 16 days during that month in order to utilize the monthly rate. Otherwise, it would be billed at an hourly rate.
Follow up?
Yes, sir. Not to that question. I wanted to Representative Trabulsi did a committee hearing last week with a bunch of educational and work development providers for students who want to get a job. One of the questions that was asked at that committee hearing was, are you working with your workforce boards to make sure employers know about that? So my question is, for these providers that you're working with, that you're trying to seek employment for, there's several things. Are you working with VR? Are you working with your workforce boards and your talent pipeline people? And are you also, this population in general needs a job coach with them at the work site, at least initially, to do hand over hand, like teaching. And I'm just wondering, is that something that you do? And is that something that APD job coaches do? And are you at least affiliating yourself with that network with VR and these workforce boards?
Recognized.
Thank you. Yes, we do have constant communication with vocational rehabilitation, working together to identify like clients and ensure that services are being provided on both sides.
Anything else?
Mr. Chair, and thank you, including on-site and provision of services directly with employers, so these people can actually get a job and be successful in it.
Yes, supported employment services are available to individuals, and that is one of those exact things that it should be doing. Pre-vocational services help them get jobs. Yes.
Thank you. Representative Woodson.
Thank you again, Mr. Chair.
Yes, ma'am.
Thank you. My next question to you has to do with the rates are tied into the units of services provided. Are you looking at other state agencies or other organizations comparable to Florida in order to make sure that you enhance the effectiveness or efficiency of ADT services? Are you looking at any other agencies, state agencies or organization similar to Florida or comparable to Florida? When you factoring those rates, when you're looking at those rates?
Ranking member, this shift, the discussion today is not about whether or not we're going to increase the rate or the rate, comparison. I think it would be somewhat unfair. I mean, if we would increase the rate 50%, that would be one thing, but that would be a budget increase question, whereas this discussion today is mainly about a shift in the accounting model and taking off an administrative burden for some of these providers, allowing them to report monthly instead of hourly. So I would just say I think we could all agree if we had more money, that would be one thing. But if the question is, I guess the comparable rate that's currently being paid, I guess if y'all are willing to say whether or not you think our rates are fair right now, I'm sure there's probably some providers in the audience that would, have some input as well. But you're welcome to answer if.
I can't speak to the rates, but to part of your question, in the December report, Milliman did include information on other states, but that was more on the approach. So they did some significant research on how other states model their payments for similar services. So that was taken into consideration just when that information was provided from Milliman to the agency in that original December report.
And Ranking Member, if I misunderstood your question, I apologize. But
I think you did.
You think I did?
Yeah.
Well, then feel free to correct me.
No. But usually when you look at rates, and I have dealt with, similar items, you can look at other states to see exactly what they are doing, how they are reimbursing the providers, just to make sure you cover all the bases. You don't leave anything out. Because we want to be fair to the providers, especially with the population that we are talking about. And if we're not paying them enough, who would pay the consequences? The client, right? The person. So this is why it's good to look at other models also, because we want to provide quality services to this population. So this is why I asked the question, because everything's helped. Thank you, Mr. Chair. I had another question that I had written. Maybe that might be not appropriate for them as well, because I was thinking of, you all are administrators of the program as well, right? So what would be your long-term vision for the rate reimbursement that you're looking at? What would be your long-term vision for ADT in our state? And how do those new rates would fit into the vision that you have? That's my last question.
Thank you. That is a very thought-provoking question.
Thank you.
And I don't know that I have a fabulous response for you this morning, but I would think that the long-term goal is that clients are getting served, that there are providers available to serve them, and that it's a seamless situation where everyone is happy with the outcome. And does this rate do that? I would hope that we're working towards that. And in concert with the provider community, we will have a successful outcome.
Representative Bolsey, you're recognized.
I'm a newbie, right?
I apologize for the phraseology.
No, I'm just teasing. Thank you for being here today. Appreciate the update. My question is, you just said happy ending. So what is a happy ending? And in that, if your goal is bringing these folks in and offering training to them, do you have a number or percentage of how many people you serve versus how many people actually get jobs in the workplace.
You're gonna.
Thank you. I do not have those numbers in front of me, but we can certainly follow up with you and provide additional detail.
Any follow-up? All right. Members, any other questions? Of course, you're recognized.
Thank you very much. If you could just elaborate too on the first part of that question, which is what is a happy ending? What do you consider a happy ending?
Thank you. In terms of clients getting served, that there is not a shortage of providers able to take an individual and provide that opportunity for meaningful day activity. That clients have a place to go and they are learning, they are building skills and meeting their needs and goals, and that the providers are there to support them.
Do you feel like we're accomplishing that, or there's still work to be done?
There's always work to be done. I don't think that it's ever an ending process. We can only improve and hope to improve.
Great, thank you.
Members, any final questions? Sorry? You had a follow-up? Representative Woodson for
Thank you, Mr. Chair. Thank you so much. This question has to do with us. How can we as legislators support your vision in order for you to continue to do your work and to make sure that providers and clients, they all are happy with what you're doing? So how can we support you as legislators?
other than providing additional funding?
Uh-oh.
Well, I think that by giving us opportunities to come present to you like we are today and have this kind of dialogue, it gives us insight into the types of work outcomes that you're looking for from us, which then in turn can help us, drive our policy making at the agency level and make those decisions on how to craft our budgets within the appropriations and with the money that you have given us them wisely and in alignment with the legislative direction.
Thank you. I'm good.
All right, well, Ms.
Thank
Dalton,
you.
Ms. Nipper,
Thank you,
thank you
Mr.
both so much for your time. We appreciate it. Thank you for coming.